It says it's recording.
Okay. Justina, do you want to bring up the presentation and share it from your screen?
I can't do that because I can't minimize Zoom while I'm recording.
Okay.
Sorry.
That's fine. That's fine. So JJ, if you want to, you can, or I certainly can, whichever you'd prefer.
Okay. Let me go ahead and share my screen.
Thank you, JJ.
Of course. Can everyone see my screen?
Yep, starting to come up there.
I see half your screen. Unless
Yeah,
it's
minimize this part.
You can't get your little Zoom window to go away, JJ?
Yeah, I can't get it to go away. Oh, there it is.
Okay. All right, so we would like to thank everyone for coming to our presentation. It is called Bridging the Gap, Military Veterans and LGBTQ Populations. My name is Dr. Amy Crowley. I am a faculty member here in the CMHC online program. I am very excited for the opportunity to present with two outstanding students from our program today. So Justina, would you like to go ahead and introduce yourself?
I'm Justina. I'm a second year student with the Chicago School. I'm actually finishing up my second year and I'll be starting fieldwork in the fall.
Great. And JJ?
Hello, everyone. My name is JJ Jackson. I'm a master's candidate. Yay. The program is my final year. And I am towards the end of my practicum, and I'll be starting internship one very soon.
Excellent, thank you. All right, we are going to go ahead and get started. So JJ, you're up first whenever you're ready. Thanks.
Okay, so I'll be going over why we decided to choose the topic. So when working with individuals who identify within, separately identify as a queer person, and then they identify as a military veteran, we realized that the two independently were largely marginalized populations, are marginalized populations. So Justina and I wanted to kind of bridge the gap to see, well, what would it look like for an individual who actually identifies as both? So they identify as a queer person and a queer person who happens to be a military veteran, and wanted to understand the intersectionality of both of the identities and not just singularly or by themselves. And so in doing that, we also wanted to bring in our personal perspectives of what it meant to be a person who identifies within the LGBTQ community. And then Justina has a vast experience working with individuals who identify as military veterans. So we wanted to, of course, throughout this entire presentation, increase awareness of the counselor's limitations, because oftentimes what happens is we have people who say that they worked within a certain field, and then there is the assumption that they know all that is to know about that population, when we should understand as counselors in training that that's not the case. And so that's why we wanted to bridge the gap. You know, where are some of the what is some of the misinformation, and how can we bridge that gap between what we think we understand and what we should be knowing, or what we should know when approaching or engaging with individuals who identify within this unique population.
You're muted, Justina.
I just thought I unmuted myself. I'm sorry. So we have a few terms in this presentation that we'll be using. And when we refer to LGBTQ, we're using it as an umbrella term for sexual orientation minorities. And we're specifically choosing to separate out gender identity due to the recent changes in transgender rights for military personnel. So we try to condense it into a smaller presentation. When we say military veterans, we're referring to individuals who are no longer active duty. And when we talk about cultural humility really requires a person to understand their own cultural identity and understanding that sometimes within relationships there are imbalances of power, as well as being able to deeply reflect and to hold themselves accountable for their actions. So cultural humility is not the same as cultural awareness, cultural diversity, or even being culturally competent. And an individual cannot say that they understand cultural humility by just taking a course or multiple courses on multiculturalism and diversity, because it's kind of a lifelong process when you think about cultural humility, because as we grow as people, we learn more about different cultures. We learn more about our own cultures as well. And, accepting and understanding cultural humility as a lifelong journey requires being able to admit biases that we have. It requires significant self-reflection, awareness, and recognition to the imbalances of power, and acknowledging that beliefs held by ourselves, our clients, and our community sometimes affects us, whether it's in a positive way or a negative way. A clinician's ability to recognize an imbalance of power is crucial to the recovery process, because someone who has a difficult time finding adequate care could be due to socioeconomic status, or some clients view effective care as a waste of time due to their cultural values and beliefs. Some of the major influences that we found are that a counselor's level of cultural humility affects substance use and addiction within the LGBTQ military veteran population, because it encompasses a plethora of beliefs and biases. When people learn that someone is a veteran, there's always these stereotypes regarding how the veteran is dysfunctional, how they must abuse drugs, or how they act crazy. And many of these predisposed beliefs affect the way that we treat and interact with these individuals. How a counselor interprets military and LGBTQ cultures will directly affect LGBTQ military veterans. It may affect the way that they perceive themselves, the way that they perceive their identities, how they live their lives, how other people perceive them, how counselors perceive them, and how the counseling process is like. Many individuals who have biases about counseling could have had negative experiences while seeking mental health services in the past. And counselors need to be aware of all these different factors, because they all carry weight when it comes to the therapeutic alliance. A lack of cultural humility may result in substance use as a coping mechanism because of inadequate care from counselors. Counselors need to immerse themselves in different cultures other than their own, because how can we as counselors ask our clients to lean into discomfort if we're not willing to do it ourselves? A counselor who is knowledgeable and open about cultural humility really understands that their gender, ethnicity, and race could determine how a client perceives them. For example, some male clients would prefer female counselors, whereas some would not. Just as how some female clients would prefer female counselors, whereas some may not. And it's significant to highlight that a counselor and a client who identify with the same ethnic background might not have lived the same life experiences. It's crucial that counselors do not make assumptions about their own cultures as well as their clients' cultures. Gaining knowledge about cultural humility and being immersed in different cultures takes effort. To truly understand an individual's cultural perspective, a counselor has to be able to build genuine relationships with individuals of cultures other than their own. A lack of cultural humility can present itself in many different ways. An excellent example of how a lack of cultural humility presents itself in counseling is a Hispanic male combat veteran who identifies with the LGBTQ community is seeking counseling because he feels responsible for the death of his sergeant in Afghanistan. And the counselor informs him that coping with the death of his sergeant is the same as getting over a breakup. The counselor proceeds to tell him that he needs to get over it. The combat veteran becomes consumed with anger and declares to himself that seeking counseling services was a terrible idea and that he hates counselors. As a way to cope with his anger, his guilt, the pain, and the suffering is by drinking alcohol until he blacks out. As a result of his drinking habits, he has found himself in dangerous places, not knowing how he got there or even where he is. In this example, the counselor's lack of cultural humility actually violates the American Counseling Association's Code of Ethics. It violates ACA Standard A1A, Primary Responsibility, Standard HUC, Developmental and Cultural Sensitivity, Standard A4A, Avoiding Harm, Standard C2A, Boundaries of Competence, and Standard C2D, Monitor Effectiveness. It is important for counselors to understand situations like the one I just spoke about because it could lead to life-threatening situations. The suicide rate among combat veterans is very high, so a counselor who lacks cultural humility could potentially play a role in a LGBTQ military veteran's decision to attempt to commit suicide or commit suicide. Cultural humility must include not only specific identities of the client, but the intersectionality of these minoritized populations. So we have to understand that understanding LGBTQ culture and understanding military veteran culture is not the same as understanding LGBTQ military veteran culture. As counselors, it's highly significant to be aware of the intersectionality of identities that our clients identify with. If we view these specific identities separately, we cannot gain an understanding of our client's perspective. Identifying with LGBTQ culture could be dangerous for certain individuals depending on where they're located in the world. Certain cultures and places condemn LGBTQ culture, and individuals who identify with LGBTQ culture are at high risk of persecution, prosecution, and even death. Identifying with LGBTQ military veteran culture could also be dangerous because of some of the environments these individuals are in. Individuals who live in LGBTQ military veteran culture have a major target on their backs because not only do they identify as LGBTQ, they're also military veterans. They do not have the same access to health care as military veterans do. The VA does not take responsibility in training their healthcare providers to understand cultural humility or LGBTQ military veteran culture. They encourage individuals who identify as LGBTQ military veterans to come out to their healthcare providers. However, they also tell LGBTQ military veterans that if their healthcare providers are not accepting of the identities that they identify with, then they should just find another healthcare provider. In a sense, they're literally only perpetuating the broken cycle, and it goes in a circle and it's never ending. The four selves within our presentation are self-identity, self-awareness, self-accountability, and self-reflection. So all of these 4 selves are crucial to personal and professional growth as a counselor. Self-identity includes characteristics, traits, and abilities that we would use to define ourselves. This includes our own understanding of ourselves, and self-identity is a prominent concept because as human beings, we use it to help us understand how we contribute to and fit in with society. It is important for counselors to understand their own self-identity because it could affect their relationships with their clients. And many clients also have countertransference with counselors, and it's challenging to build a strong therapeutic with a client if you remind the client of someone they dislike or someone who caused them harm. Self-awareness includes being aware of our existence of self, our perspectives, beliefs, values, behaviors, and how they affect us and others. The concept of self-awareness is significantly valued in the counseling profession. So some individuals believe that counselors cannot be successful in the counseling profession without self-awareness. In order to have self-awareness, our sense of self must exist. Our sense of self must be available for observation. Our sense of self must have a long-lasting nature, and our sense of self must be able to be defined. While this may be a bit odd, some individuals have a poor sense of self or a poor understanding of their sense of self, which will translate into lacking self-awareness. If you do not know who you are, it's challenging to know how you affect others and how others affect you. Our sense of self must be available for observation because we change as we grow. Our sense of self as a beginning counselor won't be the same as our sense of self as a counselor who has been working in the field for 20 years. Our sense of self must have a long-lasting nature because it has to be stable. Without stability, our sense of self will lose liveliness. Our sense of self would lack significance and meaning if it cannot be described. Self-awareness is important to the counseling profession because it allows us to grow and understand how our thoughts, actions, and behaviors affect others. We must have self-awareness in order to grow and teach others to have self-awareness. Self-accountability is holding yourself responsible and accountable for the outcomes of your thoughts, behaviors, and actions. By being self-accountable, you must stop making excuses and blaming other people for your thoughts, actions, and behaviors. Self-accountability is significant to the counselor and client relationship because we need to own our thoughts, our actions, and our behaviors. Everyone has biases about certain people, certain topics, certain objects, and self-accountability really allows us to own our biases and hold ourselves accountable for them to be able to understand how they affect us and how they affect our clients, as well as our relationships with other people. Self-reflection requires a deep dive into understanding who we are, what shapes our perspectives, how our values and beliefs affect our relationships with others, and how we behave towards individuals who are different than us. Self-reflection is significant to the counselor identity because it is the understanding of who we are and how we are. Being able to self-reflect allows us to be aware of areas that are challenging for us and for us to be able to actively work on these challenging areas in order to grow. So in a sense, self-reflection is kind of like the glue that ties together self-identity, self-awareness, and self-accountability. In order to be effective and competent counselors, we have to be able to self-reflect. And many practitioners believe that self-reflection is the key to building self-awareness. There are 3 types of self-reflection: reflection in action, reflection on action, and reflection on self in or on action. Reflection in action is when clinicians make choices based on specific situations they're in and their knowledge about the issues that are occurring in that situation. Reflection on action is being able to reflectively think about the situation after it has occurred. After engaging in reflective thinking, the counselor will be able to consider what they might have done differently if that situation were to arise again. Reflection of self in or on action is described to be how clinicians reflect based on the influences of their personal experiences. So this translates into how personal experiences influence our professional sense of self. So let's transition a little bit into what military culture is like. So military culture is kind of really hard to explain because it's a culture that has many, many different subcultures depending on the branch of service that an individual serves with. Military culture opposes different factors such as orderliness, camaraderie, teamwork, sacrifice, trust, hard work, and uniformity. And when individuals join the military, they're really a part of a super close-knit community. And there's a really strong emphasis placed on group or unit achievements rather than individual goals or individual achievements. And in military culture, it's always about the greater good of the unit and the group rather than the greater good of the individual. Military culture provides a strong sense of community as well as structure. And in the military, a service member's commanding officer is involved in basically every single aspect of that person's life, whether they like it or not. And this includes their family life, finances, legal issues, any issues dealing with abusing substances such as alcohol. And views of military culture are viewed differently depending on the individual. So if they're a commissioned officer, a warrant officer, if they're enlisted, if they're non-commissioned officers. And these views also include active duty, National Guard, and reservists. And each branch of service has a different set of values to uphold. Of all the branches, the Coast Guard is the only one that is under the Department of Homeland Security, and the other branches, including the National Guard, are under the Department of Defense.
Alrighty, so as we consider LGBTQ culture, it has some parallels to military culture, given that there are a varied amount of subsects, there are a very amount of different identities to which one could belong or one could identify as. I think one of the most important things to consider is, how occupying a sexually divergent identity reflects a counter narrative to what we consider to be dominant ideology about expectations centered around sexuality and gender. So for instance, we do know that heterosexism is the dominant discourse or is the dominant ideology when we think about expectations of self and sexuality and sexual orientation. So if you occupy a identity that counter that, then naturally you become not extricated, but you become a minoritized population just by default because you're not the major or the dominant discourse or the dominant ideology about sexual orientation. And I included like a section about emphasis on language, because as emerging clinicians, we have to be careful about how we talk about certain populations just as much as we engage with them. And so there's this coming out process, which I'm sure everyone is familiar with, to where a person who identifies as queer comes out to the larger community as a queer person. And so it's just simple things about how could we frame coming out differently, because that has stigma attached to it, obviously, because one would not have to come out if that wasn't the dominant ideology about their gender or their sexual orientation. So I said, well, how could we frame it differently into inviting in? So this person already occupies that identity, so how could we be invited in on this person's journey? So it's just an example of how we as clinicians could shape, or how we determine through our actions and through our words that Justina mentioned earlier, to create a more therapeutic interaction with someone who may identify as a queer person. And as we continue, within this culture, there's a high emphasis on community, inclusivity, and acceptance given the social consequences of belonging to a queer identity. Again, it's backing up what I was saying about how if you are a heterosexual person, you're largely of the dominant ideology. So therefore, anyone who is outside of that, unfortunately, has to face the consequence of not belonging to mainstream identity. So that's why the emphasis is on community, is on inclusivity and acceptance. That is why we seek to be affirming when working with LGBTQ individuals, because largely society has not been able to be as affirming as they should be, given everything that's involved within a queer identity. And so as we move on and we consider what is the implications within the counseling relationship, like what is the implication, like how can we bridge the gap between, okay, this person identifies as queer, so how can we engage with them and what can we do to provide sort of that supportive environment for them to not only grow, but to feel affirmed, to feel validated. And so there's a model on risk and resilience, which largely seemed to be a huge theme as I was doing research upon like what is something that stays consistent, and that is a model on risk and resilience. So, and then we have to consider if a person was to come out, you know, what is the risk that they're taking to come out? Because it's larger than just I'm identifying as queer for the whole world to know, but then when I go into other, or when I have to navigate other social spaces, am I a threat of harm? Would I have to try to suppress my gender identity or my sexual orientation for fear of retaliation or fear of harm? But will the risk override the opportunity for resilience? And resilience is a large protective factor, because the more resilient I feel or I am, then that overrides my perception of risk for living authentically within my identity. So it's very important for clinicians to understand that there's a risk and resilience factor. It's like a tug of war. So, and which also becomes more layered when you add race, when you add class, when you add SES, when you add education level, when you add age, you know, all those things play a part into the identity of the person that's sitting across from you. And as we continue on, the focus within queer culture is on an influx of protective factors over an increase of risk factors. So generally, we would want our client to have a support system. We would want them to have as many protective factors that they can identify, so that way their overall mental health and well-being is shaped for the better. But we do know for this culture, based upon research, that an influx of protective factors will be largely shaped or determined by the perception or availability of support. Working as a clinician now, most times what seems to override any engagement into care or any engagement with mental health services is the idea of, do I feel supported? Do I feel affirmed? Do I feel as if someone is actually listening to me? And so that will largely override any type of therapeutic intervention that one may have. It's just, do I feel supported? It's the contextual factors, right? It's the intangible things that we can't really plan out. It's just things that has to be within the counseling relationship in order for a client who identifies as queer or within the LGBTQ culture to feel supported and to grow. So before this section, we did have a video, but I was trying to get someone who identified within LGBTQ, who identifies as an LGBTQ military veteran. And I was unable to get the video, but he did share some sentiments with me. And basically what he was telling me is, if you identify to one part, like as we dissected both identities, we both saw that there's a risk for stigma for belonging to either or independently. But when you identify as a queer vet, a queer military vet, and he's a male of color, then there's added consequence, because there's the idea that I belong in the military. So there's that culture, and I have to be not only uniform, but I have to be indoctrinated into a new way of thought that may be counter to my lived existence every day. So he said it's a continuous battle. And he said he copes by using substances, because oftentimes now that he's out of the military, he sort of doesn't lose like the getting up at 6 o'clock in the morning or hearing like loud sounds or trying to converse with people or try to have social relationships. He doesn't feel as though he could adequately be himself authentically because he's been indoctrinated into 2 different cultures that have 2 different expectations that are kind of providing like a dissonance in so as we continue on, we're going to look at intersectionality between a veteran and an LGBTQ person. And this kind of goes back to why we chose this topic in the first place, right? So we recognize that there are gaps in policies and available services for people who identify as this specifically. Now, if we were to separate the 2, of course, we'll find a plethora of research available showing us like services for veterans, services for people who identify as queer. But when we bridged the 2, we had some difficulty finding research because there was not too many that identify or supported this identities explicitly. And so we are also understanding the fact that victimization and homophobia remain common, although there's some increasing support for queer identities. If we were to just look at this identity at an intersection, largely there is still the stigma that remains, and it still influences how this person walks around life. And so there are elevated risks of PTSD and alcohol abuse, naturally given the emphasis on coping mechanisms. How do I cope with 2 not only minoritized populations, but how do I cope with identifying or belonging to both? And who do I talk to? Because if we have a gap in policies and available services, so that means that no services are available for me. And if they are, they're not in my area. And then how do I combat the stigma of belonging coming from homophobia and the victimization? So how else do I cope? So we saw that there was an elevated risk of PTSD and alcohol abuse for individuals who identify at this intersection. And so there's the added stress due to them serving in silence, as I alluded to earlier. That's the dissonance that's in that person's head. How can I fully serve my country when I know that my identity is still not accepted within this culture? And how can I be expected to live authentically if I don't feel like I'm supported within something that is not only my livelihood, but this is my career, this is something that I'm in. And so we recognize that there's a conflict, right, between counseling associations, how they approach individuals who identify as queer, and then individuals who identify as veterans. So there's 2 different, not competing, but conflicting expectations for the individuals who work within these populations. So we have to acknowledge that as well. And overall, we want to assume that a counselor has a willingness to explore the client's experiences and not try to assume, oh, because you identify as a vet, this means this, and this, you identify as a queer person, then that means that, oh, we bridged those together, so this means this, and this, which is not the case. And that is something that we attempted to bridge the gap on. And the assumption is that as we continue to work with individuals who are at many different intersections, that means we're going to deal with a lot of complex identities that require a little bit more evidence-based interventions in order to, of course, not do any harm. But at the same time, we have to understand that these identities, no 2 queer identities are the same, no 2 military veterans experiences are the same. So if we were to bridge those 2 together, then we definitely know that those 2 identities will not be the same. And so that is what we were trying to accomplish here.
Thank you, JJ. All right, the next section is mine, and it's going to be on the importance of cultural humility with LGBTQ military veterans. So, first is, why is cultural humility important when we talk about this particular population? We reviewed the complexities of both of these populations, as well as the intersectionality of their identities of being a member of the LGBTQ community, as well as a military veteran. Both Justina and JJ discussed how these populations have a specific culture, and when it is combined, the intersectionality of those identities adds many more complexities to both understanding the LGBTQ military veteran population and also a counselor's competency in working with the LGBTQ military culture. Research has shown that there is a conflict between treatment guidelines set forth by counseling associations and the statutes of the Department of Defense. This conflict leads providers to attempt to discern which they should follow. Should they be more apt to follow their professional association guidelines, their code of ethics, or do they feel that they align more with the policies and statutes of the Department of Defense, especially if they are an employee of the government? This can certainly impact their view on which policy or procedures that they wish to follow in order to avoid any potential reprimand. Counselors who are aware of and follow the ALGBTIC, that's ALGBTIC, stands for the Association for Lesbian, Gay, Bisexual, and Transgender Issues in Counseling. So the ALGBTIC competencies for counseling LGBTQIA individuals are more likely to understand their own culture and the impact it has on working with this population. Now, ALGBTIC also has a competencies for working with transgender persons. However, as Justina talked about earlier in the presentation, we specifically pulled that population out for the purposes of our presentation today, given some of the rollbacks of opportunities, privileges, and rights for transgender military individuals. It's kind of outside the scope of what we have time to talk about today, but certainly something that we can address in a future training. So if counselors utilize the ALGBTIC competencies and the knowledge that they gain from reviewing, studying, receiving training on these competencies, then they can begin to operate through a lens of increased awareness, knowledge, and skills regarding this population. In addition, a LGB affirmative and contextually sensitive approach means the counselor must be willing to explore the client's experiences, understanding that there's likely to be internalized conflict for the client given the stigmas that they've had to face as both a member of the LGBTQ community as well as a military veteran. Counselors need to be trained in culturally responsive practices to take into account both of the separate identities as well as the intersectionality of those identities, given the social and political climate of our times, which also means that there's likely to be changes moving forward in the future as our society and our politics continue to change. It is highly recommended that training for mental health professionals who work in Veterans Affairs include specific training on the LGBTQIA population. While this may not be a typical part of onboarding training, it can be implemented at a later time as part of program training, maybe even becoming mandatory, and individuals can seek out specific training on the LGBTQIA population. They may have to do so on their own or part of their continuing ed requirements. And the VA needs to seek to hire sexual and gender minorities who are also veterans so that the staff these clients come in contact with look like them and can relate on more than just a professional level. One of the difficulties with this is that it means a shift in the work culture of the VA to allow those who are sexual and gender minorities to feel comfortable to express their authentic selves and to provide a safe environment where they can be open and out with their identities. So next slide is how clinicians can begin to work on their own cultural humility. So first, counselors need to confront their own biases. We all have them. There's no shame in that. The difficulties come when a counselor believes they are bias-free, refusing to address their biases. One course on diversity will not help you address all of your biases. This is a lifelong process, and you should always be working on identifying and confronting your biases through your own exploration, through counseling if necessary, and certainly through the utilization of supervision. This means that counselors need to recognize their own limitations in working with this population. If you do not have adequate training and or are unable to work on your own biases, then you need to refer the client out. This is especially true for non-LGBTQ veterans who work at the VA, though this is not a reason to refer a client out simply based upon you not agreeing with their sexual or gender identity. As we know, that would go against the ACA Code of Ethics. Offices need to work on utilizing affirming language to avoid stereotypes and heteronormative assumptions, such as all couples are developed between one male and one female. Forms need to be revised to allow for blanks rather than checkboxes, which many individuals find to be very limiting. And this extends beyond just gender and sexual orientation, but even into something that's race, ethnicity, relationship design, because not everyone will fit neatly into the box that society tries so hard to put them in. Offices need to openly display an affirming environment with visual cues such as stickers and signs. Be mindful of the magazines and pictures that they display to assure that they're showing diverse individuals. Now, this is an active part that must be taken by the offices, specifically if the VA, if that's who's serving the veterans, but also within the community. So even within your own community, within your own agencies, you can begin to look at, does our office utilize affirming language? Does our office utilize intake forms that have blanks, allowing the individual to fill in whatever they want versus checkboxes that might limit them? Offices need to be sure that they're showing a very diverse population with pictures, signs, magazines, pamphlets, and not just sticking to the heteronormative, cisgendered white privilege that has existed in our country for so long. We know that both the LGBTQ and military veteran cultures are very diverse across all cultural identities. And though we may not be able to include every single identity in our office, we can branch outside of what has stereotypically become the norm for marketing materials, magazines, pamphlets, etc. You might remember years ago when safe zones became a big thing, and school counselors, college counselors would utilize safe zone stickers on their doors to let an LGBTQ individual know that it was an environment in which they were safe to share about their identity. While this may still hold true for many individuals and that visual cue may be very helpful for them, the fact of the matter is that over the years it has been misleading. In addition, we need to look for counselors who have training in both LGBTQ and military veteran populations. Unfortunately, an individual might identify themselves as having knowledge, maybe even training, but it might not really be specific to these populations. I can't tell you how often I hear from clients who are seeking services who've been harmed by other counselors who, when creating their clinical profiles, go down the list and check all the boxes off. I serve all populations, all identities, and yet they walk into an environment that is not affirming, that is not accepting, that causes them to feel scared of divulging maybe part of their identity and potentially one of the very reasons they're seeking counseling to begin with. So it's really important that clinicians work early on to address cultural humility in themselves, seeing where their limitations are and where the limitations of the environment in which they work are. We're also held to our code of ethics that ask us to advocate for clients. And so at your work site, it might be important for you to use a little bit of that advocacy and advocate for your clients or the diverse clients that you could see in your agency to assure that they are also being considered when your agency looks to change the artwork or the magazines in the waiting room. So that kind of wraps up our presentation in terms of the information we wanted to provide. Our next slide has a lot of references on it that supported our presentation. And certainly as we are finalizing our time here, we would like to just open it up to any questions that any of you might have. Be sure to unmute yourself if you're going to talk so that we can hear you.
No one has any
I have a
questions.
question. I actually have a question, or a comment for that can be further clarified for me. Um, for instance, with somewhere in the presentation, I heard that when going to a therapist that doesn't that particularly within the military culture, the clinician may not have the training or the desire, the open-mindedness to treat someone who identifies within the LGBTQIA community, and that would that starts over a cycle. And just in my personal life, like with me living with a physical disability, and I go to a doctor who doesn't do the due diligence to consider other avenues for treatment for me, then I am going to find someone that will treat me as the individual that I identify as, with all of the issues that come along with my particular ailment, so that I can get the best service I possibly can. And I just think it's kind of a really good thing that that particularly, and it's been years since I've been in the military, that people are able to find other avenues of service to get service, because I don't want to be stuck with someone that already has a bias towards me, not willing to do the work for me, to work with me, and then I'm being harmed instead of helped with me trying to get service. So I really, like, even with me working for a county, I pay extra so I can go outside of the network to get the services I need.
And what a shame that is the option that you have left, is that you can't find adequate services within network. And this presentation wasn't necessarily on barriers to treatment, though I do often present on barriers to treatment. And certainly one of those is the limited population of trained clinicians, and the need for the ability to afford services with those that are trained. You know, and this goes deep, deep, deep into the LGBTQIA population, as well as the military veteran population. Their services needs are complex, and they don't always fit the clean mold of a simple PCP visit. And so now all of a sudden they're trying to travel long distances to find providers. They're having to pay additional cost out of pocket that may or may not be reimbursed eventually by insurances. So it's definitely a barrier for services, and the importance of having more fully trained across the board clinicians available for clients. You know, even if you don't work directly at the VA, chances are you're going to see a military veteran at some point in time in your practice. Same thing with the LGBTQ population. They're probably already there. Maybe they're talking about it, maybe they're not. But being willing to be trained yourself and assure that you can meet the needs regardless of the identity that your client walks to the door with, or at least attempting to, because we certainly can't all be trained in all identities, but working towards that is how we work towards becoming more culturally competent and meeting the needs of our clients.
I wanted to kind of when you mentioned about the oftentimes sometimes when you look at some of the profiles of certain services that counselors and how they check off everything of all the services they provide, and then when an individual, you know, whether it's LGBT or other populations go in, they realize that necessarily the person is, I mean, I guess, how does one, I guess, become, how how does one in practice keep from doing that? Because I think for all of us, we are naturally empathetic. I mean, we enter the field specifically because we deeply care about other people and doing what's right for them. And in our caring, sometimes that can lead to blind spots of a lot of ignorance. But how does one apply themselves in a certain way where that's just that, where you encounter less and less of those blind spots as a practitioner? If that makes sense.
Okay, well, just to answer your question, I mean, I think it's something that's alluded to as we matriculate through this program, is that, you know, we'll never reach like the epitome of cultural humility or cultural competence, but we can definitely strive for it. That's why we have competencies. That's why we have ethical codes to keep us aligned to what is expected of the profession. Now, as a human being, of course, we want to care about the well-being of our clients, but it's also the small things, like things that Dr. Crowley mentioned, like just the way you do your intake form. You know, a simple question could change the course of the person wants to see you again, and you may not be aware they're standard forms for you, but you don't consider other identities. Now, we're not saying having a 10-page intake, but at least be mindful of the identity that you may approach, and just be aware of the population that you want to work with. You know, that's the importance of networking. That's the importance of researching on best practices, because it'll change in an instant, but we have a large amount of information to pull our resources from, to at least stay as abreast as we could or as we can as emerging clinicians, and just make the effort. If you make the effort, then I think that'll be more pardoned than you actually being ignorant. Say, no, I know everything there is to know. I took one class on diversity, or I have like several gay friends. I have several military veterans that are friends, so I know all there is to know. You may have an experience, you may have a thought, but actual clinical training, you may lack. And I think for some counselors, it may be an ego shattering thing, because they say, oh, well, I thought I knew, but then let it be a learning moment. I think, you know, we jump into it, be like, oh, I know all there is to know, therefore I can just make something happen, which is not the case. We definitely don't want to do harm. In this case, just strive to make the effort to align yourself with the ethical codes, the competencies that we have for our profession.
Well, and I would like to just add real quick to what JJ was sharing in response to Giovanni's question is, you know, simply being a member of either one of these communities does not make you competent to treat that community or the intersectionality of an individual with these identities. And that's sometimes really hard for an individual to hear and to absorb, that, well, wait a minute, that's an identity I have, which is true, but that's one piece of your identity, and you're one part of that culture. So as a woman, I have to remind myself that I am cisgender. I present feminine. I identify as a female. And so there's a lot of assumptions that come along with that put on me by society. The same is true for, you know, acknowledging and recognizing that as a Caucasian woman, I have privilege in that. My race gives me privilege, but as a member of the LGBTQ community, I then lose a level of privilege. And what does that mean? And that experience is going to be very different than another individual who may identify as part of the cis female LGBTQ community, but come from a different race. So we just have to be very mindful that we are simply a component of, and being willing and open to learning about the others within our community and the intersectionalities of these identities, that's going to help us continue to work towards cultural competence and really absorb what JJ said, which is that it's not a point in time. You don't just arrive at cultural competence, but it's something you seek to do throughout your life. And you won't have it all down pat, and you'll still make mistakes, and that's okay. That's part of the process.
Yeah, it's kind of like when I read some of my discussions in the past, I kind of like take a gulp. I'm like, oh God, did I really write that? It's, you know what I mean? And it's certainly, it's humbling to, that's all I'm saying on that.
Well, and that's it. It's cultural humility, Giovanni. You know, it's about being humble. It's about acknowledging our own identity. So I know we are just about out of time. I want to thank everyone for coming and spending this hour with us. We hope that you're able to walk away with some helpful information. It's something that will increase your own knowledge and awareness. Jennifer nicely put in the chat window the link for completing the evaluation. We ask that you do it even if you do not want CEUs, just so that we have the feedback as well. And otherwise, I will just say thank you all. JJ and Justina, thank you for presenting along with me. This was a wonderful topic. And actually, JJ, Justina, and I will be presenting a very similar topic to this at a national conference at the beginning of October in Orlando, Florida. So we're very excited about that as well. So it's a great opportunity for us, as well as to continue to get the word out about this population and the intersectionality of these identities.
This was really great. Thank you, guys. I'm not signed on as Dr. Soley, so that was another room monitor who posted that. So remember that is.
Oh, sorry. Yep. Force of habit.
Yeah.
Sorry.